gëj a dem lopitaan pour nemmeeku sa wérgu yaram ndax xam nga sa wérgu yaram fu mu toll est-ce que yaa ngi bàyyi xel si li ngay lekka wala exercise bokk na si li ngay sóoraale si sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne si suñ programme yi health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wérgu yaram.
My name is Dr. Mathew Anyanwu. I'm a senior lecturer with the University of the Gambia and also a consultant of obstetrician gynecology, Edward Francis Moore Teaching Hospital. By the grace of God and His divine providence, I'm also the Chief Medical Director of Elemats Specialist Hospital, fertility center that has brought IVF HC practice in the Gambia for the first time. It's been a long journey as a consultant of obstetrician gynecologist. I've been in the practice for many years. I've been working in the Gambia also for like 20 years, seeing the trend of things, managing women in various capacity and also at various places in the Gambia with different problems they come with. So, but what has stand out in the last couple of years is issues regarding infertility management, which hasn't been robust enough because of some limitations we encounter in the practice. It's very unfortunate. I describe it as frustrating, and many of us were actually frustrated in the past. When you think left, think right, think up and down, the only solution is the woman should leave the Gambia, and you ask yourself where would the person be going now? If you've not gotten good result or good report as to the neighboring place very close to us the person can go, and far away from here is expensive. It's really expensive. The ticket, the air travel, the time loss, the accommodation, a lot of challenges. And you tell them, well, that's the only solution for us. We cannot do anything more because what we have discovered is naturally to conceive will become very difficult, if not impossible. Perhaps she has tubal blockage. Perhaps male issue, the sperm quality is not good at all. Sometimes no sperm at all. You'll be wondering what can you do then? Because you need those reproductive system to work in their perfect condition to be able to achieve natural conception by having sexual intercourse. Unfortunately, when it comes to that, the solution is IVF HC, and we say we don't have it and you can go elsewhere. After many years down the line, you still see the person coming back to you still not pregnant. They ask us, what will you be doing for the person? It's really a long time of waiting, and we are happy that today the hope has come. Solution is now at our doorstep at Elemats Specialist Hospital, where we offer hope to that family who think that hope is lost, where by the grace of God what seems impossible could become possible. We have the machine, the latest version of ICSI machine. ICSI is a machine that picks the best of the sperm, even if it is one or even half measure of it, and inject it directly into the egg of the woman and possibly get the egg fertilized. And that is formation of a new baby called embryo. From there it grows. It's available here. It's amazing, but really it's true. In the soil of the Gambia, we are doing egg collection for in vitro fertilization. This is the first time it's happening ever in the Gambia. Today, 10 women were booked for egg collection, and we were able to do 9 of them. One, it will be done on Tuesday. The very first time it's happening. We have some video clips to show the procedure during the time the egg is being collected. At the time of this interview, if I tell you what is happening now that I'm granting this interview, you'll be surprised. The ICSI machine is in full use, fertilizing the eggs. That's what's going on as I speak. The incubator, 2 of them, is ready to accommodate the embryos that will be formed from this fertilization going on now, happening in the Gambia for the very first time. My heart is full of joy. It's a dream come true. It's been a vision all this while. I know the thought, the passion became very strong since 2018. Yes. To have an IVF center became very strong, a passion that I could not resist. At any given opportunity, I'll be speaking about it. I started discussion in 2018 in Dakar with a prominent person in the fertility and treatment in the sub-region, and he gave me the encouragement. It's no other person than Dr. Ibrahim Wada, the CEO of NISA Premier. I will not hesitate in mentioning his name, for he really encouraged me and pushed me and said, it's possible Gambia can have IVF. Passion became very strong. 2019, we continued the discussion. And I was fortunate to be in his center in 2020, just before the pandemic. And I escaped the lockdown. It would have caught me up in Abuja. But before the lockdown, I arrived before March 6th in 2020. I had done a couple of weeks at the center there, looking at practice, having a few hands-on, knowing the medications that are relevant for a fertility program in the Gambia. And from that time onwards, the passion grew stronger. And I started seeing that something that is achievable. I was still looking for a place to have a center here. And by the grace of God, we were able to get here towards the end of the same year of pandemic. We started working on it. We were rebranding the place. The place you see today as Elemats Specialist Hospital was just a story building that was rented as a normal living place for anybody, where we transformed it and gave it a first lift of being a hospital environment. It took over 6 months working on this place. And today, the backside where even the IVF center is sited is a new brand building, erected and furnished at the back by the Elemats Specialist Hospital Management. So by 2021, we started here, effectively on records. Actually, we put June. That's when we started. And since then, we have been seeing patients, general patients, male, female children, trauma patients, deliveries. We have main theater here, different surgeries has occurred here. Immunization, vaccination of newborn, infant welfare, all has been happening since June 2021, and it's still growing and growing, to the level that we know that the service is available. Whenever you come, you get the service given to you. Where women clinic, screening for common gynecological cancers, family planning exercises, different types of methods. They are all available. We do all of them. I have a general doctor who have special interest in children as well. We have visiting professors in pediatrics that also visit and have days they sit. The center here is also identified by the government through the National AIDS Control Program to be a center for treating people that have HIV and also those who are pregnant and they have HIV. We have a free service program for them here, working for government, even though we are private. So a lot has happened and we are happy that we are moving from strength to strength. That is our story. That is how we have been, how we started and how we have been trying to meet the needs and services in this neighborhood and beyond that visit us. We want people to know that Gambia, as we open and cut the ribbon of the first IVF center in this nation, many have seen the video. The one thing I want to let people know is there is still more to do. There is still more to deliver in this nation. The person that was giving a speech before cutting the ribbon said, it's a nation of 2.5 million people. The population is not there, but we've seen many other countries, but we decided to bring even the latest EC machine into this country. That is a privilege. That is something that is worthy to be discussed, shared, and appreciated. And what I will add to that is many more will still be happening. We have this EC machine, and we are looking forward in the next few months to add more to it and give more service to it. So it's been a journey of progress, month to month, year to year. We are in 2023 ending it, and we started June 2021, and we're celebrating today egg collection in the soil of the Gambia, fertilization by IVF in the soil of the Gambia, embryo culture for the first time in the land of the Gambia, embryo storage for the first time happening as I speak now in the soil of the Gambia. Toweling the embryos and doing embryo transfer in the next 4 or 5 days will be happening for the first time in the Gambia. History is made, and that's my joy. It's not expensive to do it here. Here is the cheapest place to do in vitro fertilization, IVF, the whole world. It's the cheapest. Anywhere else they offer you something cheaper than what we're offering, then it's not IVF. It's the cheapest you can get anywhere. Why? Because we are not primarily chasing after money on this. We just want to make history. Our passion is let the whole nation, let everyone that has infertility problem that deserves in vitro fertilization, you've been told your condition has become hopeless, be it your age, be it the tubes are blocked, be it the sperm is not there, find your way to this place. There will be solution. There will be surely solution for you. I'm saying it proudly and boldly because I have seen and I have believed, because it has worked. We have our record of success. We have our record in this place, Elemats Specialist Hospital, in collaboration with our partners, Care Diagnostic Clinic, Abuja. We have our record jointly that we know this is our record, our success record, or what we call success rate. Any center that offers 50% success rate in IVF is a superb center. And we are looking at a success rate of 50 to 65%, which we have seen. We have achieved that by collaboration, by people traveling all the way to Abuja and coming back, and will continue the treatment here. And we believe it's the same service, the same people, the same knowledge, even more knowledge is added now that is happening in the soil of the Gambia. We anticipate the same, if not more, success rate than what we had before. Many people have come in the past from other countries because they check on the internet, they see the name IVF. The IVF has been attached to this hospital for many months now because we have the medications, we have the injections that are used in IVF centers. We have them here since early last year. We've been giving that injection. That's January 2022. People have come far and wide, and they have arrived here for various reasons, seeking for IVF service. We tell them about the travel at some point, and you see the disappointment on their faces, and you will not see them again come back. My message for them is, we will not tell you again to travel to anywhere. Everything that you now need for your fertility treatment is available here. That takes care of all the infertility issues that you may have, or you think that you have, and you think there is no solution for it. Just come and see. Thank you very much.
Me no know why them a go so young. Them a worry and fret. Your boy Sing out here once again. Keep watching Asagam TV 24 hours. Keep it locked.